Does foreskin help or hurt your sexual health? I'm Dr. Laura Stone. The foreskin isn't just a cover, it's a sensor, a kind of natural interface between the body and the world. But does that mean it's always better to keep it? Not necessarily. As men age, the skin on and around the penis naturally changes. It may become thinner, less elastic, or drier due to decreased testosterone, reduced blood flow, or everyday wear and tear. Some men find that the foreskin, once soft and pliable, now feels tight, difficult to retract, or prone to irritation. Others may develop chronic conditions like phimosis, where the foreskin can't retract fully, or balanitis, inflammation of the glands, which can affect comfort and intimacy. The foreskin does offer some ecological benefits, like protecting the glands from friction and maintaining a balanced penile microbiome. However, it also creates a warm, moist pocket where bacteria and yeast can grow, particularly if not cleaned regularly. That's why conditions like balanitis and phimosis, tight or non-retractable foreskin, are more common in uncircumcised men. Circumcision has been associated with lower rates of certain health issues, including recurrent urinary tract infections, especially in early childhood, inflammation-related conditions, and in some high-risk populations, even sexually transmitted infections, including a 40 to 60% reduction in HIV transmission rates, as shown in several large-scale studies. But the link between foreskin and infection risk is well established, especially when hygiene is suboptimal. For uncircumcised men, proper hygiene means gently retracting the foreskin every day during bathing, rinsing the inner fold and glands with warm water, and ensuring everything is dry before replacing the foreskin. Neglecting this can lead to smegma buildup, a whitish, natural secretion made of skin cells and oils, which can cause odor, irritation, or even infection over time. That said, many men maintain excellent hygiene with no issues. But if arthritis, reduced mobility, cognitive decline, or vision problems affect your daily routines, maintaining foreskin hygiene may become more difficult as you age. Some older men choose circumcision later in life, simply to simplify their hygiene, especially if they're prone to chronic inflammation or recurring infections. Circumcision in adulthood is a very different procedure than in infancy. Adult circumcision carries 30 to 100 times more risk of complications compared to neonatal procedures. These can include excessive bleeding, infection, painful scar formation, and in some cases, meatal stenosis, a narrowing of the urinary opening, which can affect urination. These outcomes vary widely based on technique, surgeon skill, and how much tissue is removed. That's not to say circumcision is unsafe, but it's a procedure that requires careful, individualized consideration, especially for older men. As men age, foreskin and glands tissue can lose elasticity, especially with low testosterone or chronic inflammation. This can sometimes lead to redundant foreskin, where the tissue folds over itself, traps bacteria, or causes rubbing during activity. In rare cases, this contributes to a condition called buried penis, where the shaft appears shortened or partially hidden by surrounding tissue. While not directly caused by foreskin alone, excessive or scarred tissue can play a role, especially when combined with obesity, diabetes, or poor hygiene. Let's explore what we've learned from large-scale studies. A major 2015 review published in the Journal of Urology analyzed data from over 40,000 men across multiple countries. The result? No significant difference was found between circumcised and uncircumcised men in any of these areas, statistically speaking. Men in both groups reported similar rates of satisfaction, arousal, and intimacy. Now let's talk about sensitivity, and where studies do show variation. In a 2007 study published in BJU International, researchers conducted sensory testing on over 200 men, half circumcised, half not, using light touch and temperature perception tools across multiple areas of the penis. They found that while the foreskin itself contains a high concentration of touch-sensitive receptors, the glans penis, or head, has far fewer of these fine-touch nerve endings, regardless of circumcision status. Interestingly, both groups performed similarly in terms of overall sensory input. But some circumcised men did report changes in perceived sensitivity, particularly a feeling of dryness or decreased response to lighter stimulation. However, the study also noted that these differences did not correlate with reduced arousal or orgasm function. Next, let's look at circumcision and health outcomes. A series of randomized controlled trials conducted by the World Health Organization in the early 2000s looked at circumcision as a method to reduce HIV transmission in high-risk populations. These studies followed over 11,000 men in Kenya, Uganda, and South Africa and found a 40 to 60% reduction in HIV acquisition among circumcised men compared to uncircumcised controls. Additional observational studies in the US, Australia, and Europe found circumcision was also associated with lower rates of HPV transmission, herpes simplex virus, and bacterial infections like balanitis, particularly in men with poor hygiene or chronic inflammation. That said, these benefits are context-dependent. In settings where safer practices are the norm and STI rates are lower, the absolute risk reduction is modest. But in populations with high infection burden, circumcision has been recognized as a legitimate public health intervention. Finally, a word on foreskin restoration and why it's growing in interest. This isn't a surgical reversal. It's a gradual, physical process using stretching devices or manual tension to elongate remaining penile skin over time, with the goal of regaining some of the coverage and function of the original foreskin. While no large-scale studies have validated the sensory benefits of this approach, many men who undergo restoration report a softer, more protected glands, greater lubrication during intimacy, and in some cases, a stronger sense of body autonomy and comfort. But they do point to a broader reality. For some men, circumcision, especially if performed without their consent, can lead to a sense of loss or discomfort that prompts a search for restoration. As always, these feelings are valid and worth discussing openly with a trusted provider. So, what should you actually do if you're over 60 and wondering whether having or not having a foreskin matters to your health, comfort, or intimacy? Let's start by saying this clearly. There is no one-size-fits-all answer. But there are safe steps you can take starting today, whether you're circumcised or not. 1. If you have a foreskin, prioritize daily hygiene. The single most important thing older men with a foreskin can do is clean it gently, thoroughly, and consistently. Retract the foreskin fully during your shower. Use warm water, not hot, and a mild, non-scented soap. Rinse carefully, then dry the area completely before dressing. If you notice any redness, odor, or buildup, speak to your doctor. Poor hygiene, not the foreskin itself, is what raises the risk of infections like balanitis, UTIs, or even chronic inflammation. And remember, as you age, your skin may become thinner, drier, or more prone to irritation. So, gentle care becomes even more essential. 2. Watch for common changes that may signal a problem. Over time, some men develop issues with foreskin tightness, scarring, or discomfort. Keep an eye out for pain during retraction or intimacy, cracking or thickening of the skin, recurring infections or inflammation, or trouble cleaning thoroughly. These may signal conditions like phimosis or lichen sclerosis, which are treatable but may require medical evaluation. In some cases, a partial circumcision or a conservative surgical revision, not full removal, may be all that's needed to restore comfort and function. 3. If you're circumcised, protect and moisturize the glands. Many circumcised men don't realize this, but after decades of exposure, the gland's penis can become dry, shiny, or desensitized, especially with aging skin. If you're noticing discomfort, sensitivity loss, or friction during intimacy, try applying a doctor-approved, unscented moisturizer, such as pure petroleum jelly or a urologist-recommended barrier cream. Wearing looser underwear that reduces constant rubbing. Using lubrication during intimacy to reduce friction and irritation. These small steps can often improve comfort significantly without any medical procedures. 4. Considering circumcision after 60? Take it seriously. Elective circumcision later in life is not a casual decision and should never be made out of curiosity or pressure. Here's what to consider. Discuss your reasons honestly with a urologist. Is it hygiene? Repeated infections? Skin issues? Intimacy concerns? Understand the healing time. For older men, recovery may take 4 to 6 weeks, and healing can be slower. Know the risks. Bleeding, infection, and urinary changes are more common in older patients. Ask about alternatives. There may be less invasive solutions, such as topical treatments, stretching techniques, or partial procedures. If circumcision is medically necessary, choosing a board-certified urologist and preparing for recovery properly will make a significant difference in outcomes. 5. If you're unsure or dissatisfied, seek honest, expert guidance. It's completely normal for older men to have questions, even regrets, about their foreskin status. Some may feel they've lost sensitivity. Others may wish they'd been circumcised earlier. Either way, you're not alone. There are urologists who specialize in helping men explore these concerns without judgment or pressure. Foreskin restoration, while still experimental, is one option. For some, simply learning how to protect, moisturize, or clean the area properly can make a world of difference. For others, a tailored treatment plan, including hormone support or pelvic health therapy, may be more effective than any surgery. So, penis with or without foreskin? It turns out that's not the most important question. What matters more is how well the area is cared for, whether discomfort or medical issues are present, and how informed, confident, and supported you feel in making decisions about your own body. If this video helped clarify some of the confusion or stigma around foreskin and circumcision, consider subscribing. I make these videos to empower men like you with real medical insight, not myths or pressure. And if you're facing a specific concern, always talk to a trusted urologist who can guide you based on your health, age, and goals.